What's going on, guys? Dr. Greg here with Movement Driven Performance Physiotherapy. Today we're going to talk about the Copenhagen plank. So the Copenhagen plank is a version of a plank type movement or position that we use to strengthen the adductor muscles or the groin muscles within the hip region. So lots of people get groin strains, especially like soccer players, tennis players, basketball, where you're doing a lot of cutting. So this is a great one to get in your routine to work the core, work some pelvic floor muscles as well as those groin muscles to be able to hold this position. So what we'll do is run through a few progressions so that you can progress or regress if you're having some pain or some difficulty with the higher level progressions. So first, let me just kind of show you the basic Copenhagen plank, and then we'll show some simpler versions and then some more advanced versions. So a Copenhagen plank is having the top foot on a chair or the bench, and you're setting up just like you would a regular side plank, except we're using that top leg instead of the bottom leg to push. So we're going to use this groin area and all of those muscles to be able to support ourselves. So essentially, we're just lifting the hips up. We're keeping chest back, hips forward. I don't want my hips to be here and my chest to be here. I want to get a nice straight line, and then I lift this off and I hold. So that's the basic one. Now, if that's too difficult for you and you feel some strain or you're trying to rehabilitate an injury within that groin area, you just make the lever arm shorter. So I like to do it on my knee. So same exact thing. I'm pushing through the inside of the knee, lifting up, rotating back, lift that other leg up, and hold. If that's too easy, we slowly go back to straight knee, but we don't necessarily have to go all the way out to just ankle on. We can do right in the middle of the shin, which will be a little easier than if I was supporting at the ankle. Once we master at ankle, then we can start to progress to some other more difficult challenges. So we can have back in this position, I come up, I rotate, and then I can lift this foot up and down. If I had an ankle weight, it'd be much more difficult. And then I can also do up and down with the hips. So again, in this position, up with the leg, in and out here. So with each one of those progressions, it's getting more and more difficult. Make sure you master the one in the knee before you move to the shin, before you move to the foot, before you add some dynamic movement like that opposite leg going in and out, or the hips up and down. The goal is to be able to maintain endurance and stay there for as long as you can and really build up that muscle to be supportive and stable for that hip and that groin area for when you're doing motions like cutting and running and all that kind of stuff. So add that one to your routine. Let me know how it goes.